40,000 in Malaysia. Kuala Lumpur, there have been a total of 62 deaths from dengue this year up to March 5, compared to 74 deaths recorded in the same period in 2015. In a statement on Facebook, the Health Minister said there were 28,122 cases recorded as of March, an increase of 1,513, 5.7% from last year. The number of dengue cases reported nationwide dropped by 166 cases last week, compared to the 2,885 recorded the week before. Despite the 5.8% reduction in cases in the 2 weeks, the ministry, however, reiterated its call not to take the matter lightly. The number of cases can spike upwards again if precautionary measures are not taken or legislation
Kita dah minta kerajaan negeri Selangor supaya meningkatkan lagi usaha, khususnya di peringkat pihak berkuasa tempatan di dalam beberapa bidang, di dalam pengurusan sisa pepejal, menjaga kebersihan persekitaran, meningkatkan lagi, memperkukuhkan lagi unit kawalan penyakit dan kawalan vektor di dalam pihak-pihak berkuasa tempatan.
The public also need to change their attitude and give priority to cleanliness and carry out the eradication of Aedes mosquito breeding grounds, as the rates of being infected is still there. It added there are 237 dengue hotspots listed in 9 states. Topping the list is Selangor with 163 hotspots, followed by Johor 54 and Perak 5. Terengganu and Federal Territories Kuala Lumpur and Putrajaya recorded 4 hotspots each. Pulau Pinang and Sabah also recorded 2 hotspots, respectively, while Negeri Sembilan and Malacca recorded 1 hotspot each. To date, Malaysia has seen 40,007 dengue fever cases with 23,366 cases reported from Selangor State alone. Because of the dengue cases increasing, the Health Ministry introduced the anti-dengue kits for high-risk states. Petaling Jaya, a new anti-dengue kit, will distribute to communities in 3 states with the highest recorded number of cases this year. A total of 100,000 kits each containing a mosticide biolarvicide that kills Aedes larva, a dengue mosquito repellent, and a lot Aedes larva ovitrap that trap mosquitoes into breeding in the treated water and kills the larva will be given out. The kits are part of the Dengue Free Community program launched by the Science, Technology and Innovation Ministry in collaboration in InnoBiology and Intergenetics. The 2 companies which are responsible in providing the technology is used in the program will be overseeing the implementation of the project. Minister Datuk Dr. Iwan Ibin called the collaboration a positive step for the country biotechnology industry. I am very proud to see local organizations that are far-sighted and innovative in coming out with environmentally friendly solutions to problems faced by the community, he said in his speech, which was read out by the Ministry Deputy Secretary General Science, Dr. Zulkifli Mohammed Hashim yesterday. A dengue-free squad, he said, will also be set up in high-risk neighborhoods with the help of the local council and which would be trained to use the kit to combat the scourge. The kit will be distributed in Selangor, Kuala Lumpur, Putrajaya and Johor between this month and September. Organizers claimed that they were expecting a 100% success rate from the program, adding that they estimate to see a result within a month. Intergenetics Executive Director Tunku Nakiuddin Tuanku Jaafar said the product had been sold in Singapore and Philippines, where it had shown good results. The program is holistic and very targeted in combating dengue. We will be using a 4-step plan known as REACT, Reduce, Educate, Active and Prevent, he said. He said while the government could introduce many programs to fight against dengue, the communities still play a big role. The onus on the community is to ensure that their backyard is not a breeding ground, he said. Plan to increase cigarette price and smoke-free zones. Malaysia has adopted 2 strategies so that the country will eventually achieve a smoke-free zone, said Health Minister Datuk Dr. Sri S. Subramaniam. One is to increase in stages the smoke-free zones in the country and the other to reduce the number of places where cigarettes are allowed to be sold, he said. These are two of the strategies to control and reduce the number of smokers. Eventually, we are hopeful that the country can be declared a smoking-free zone, although we don't know when that can be realized. Subramanian said another long-term measure was to raise the price as well as the duty on cigarettes. He said that as a ministry responsible for maintaining the health of the people, it was only proper that greater restrictions on smoking be enforced at the ministry itself. As such, he said, since the monitoring of and enforcement of restrictions on smoking were implemented at the ministry on May 1, 13 notices pertaining to offence and 7 warnings had been issued. All staff at the ministry who smoke had been instructed. An attempt program to give up the habit, and staff who did not smoke were educated on the dangers of cigarette smoke, he said. Thank you.